We do integrative health. We treat people as far as possible using natural technique. And using hydrogen is one of the important techniques that we use to heal our patients, even those with very serious diseases like cancer, autoimmune, and all that. So that is why I am so interested and so excited to offer hydrogen as a therapeutic treatment for those patients. We have a lot of VIPs and they have been using it, both the hydrogen water and lately the hydrogen inhaler, and they're doing very well. Let me start the full screen. First of all, I think all of us heard of hydrogen, but maybe you heard of hydrogen bomb or hydrogen car or hydrogen. But in terms of drinking it and absorbing it, it's a different story. But don't feel so strange, because you see in our body, at any time, there is 10% of hydrogen. We produce it from the fermentation of sugar and carbohydrate in our stomach. So of course, sometimes we produce like a hydrogen sulfide gas, which is a bit smelly. So it's a natural process. Our body uses hydrogen for cell energy, which is the ATP energy that the cells need. And something very interesting is hydrogen is the smallest molecule in the world. Very, very tiny, impossible to catch. So it is very challenging, and it seldom exists by itself. It is always attached to something like H2O becomes water, or OH becomes hydroxyl, all those things, okay? Now, before I start, obviously this is a Zoom session. I am not in direct consultation with you guys for any medical treatment. So this is not, cannot be used as a substitute for medical treatment. If you have a serious condition, it is better that you seek professional advice. But here, what I want to share with you will be all the content for your educational purposes. So when you talk to your doctor, you are well informed, okay? Everybody understand that, yeah? Hydrogen actually was few hundred years ago, somebody found it, but the guy don't know what he was playing with some iron, and then there was a gas, but he don't know what it is. So the person that is given credit, who discovered it as a distinct element by itself, H2, was an English scientist called Cavendish. The first few applications was more for aeronautical, you know, balloon, because it's very light, so you can push up the balloons. And then the first time it was recorded for medicine was a long time ago, 1888. Fat. There is a book called Annals of Surgery. Those days, when they do surgery, they write down. So this surgeon used hydrogen not for medicine, but he used hydrogen to pump up the intestine, because he want to see how big is the problem in the intestine before he do surgery. It was very difficult to see. So he used insufflation, which is pumping in the hydrogen gas, because he knows that hydrogen gas will not create any problem. So that was so many hundred years ago. But the big break, ever since then, a few people play around with hydrogen, but the big thing that changed everything was a study done by a Japanese scientist, Osawa, and his team in 2007. He's the first person to show that hydrogen actually can be a therapeutic antioxidant to protect oxidative damage. He actually proved that for ischemic condition. And ever since then, that created so much interest that all the scientists start looking at molecular hydrogen as a biomedical therapeutic agent. And today we have hundreds, almost 1,000 over now of study, and there's new ones coming up, all right? As I said earlier, hydrogen was first used for non-medical purposes. They use it to refine crude oil, they use it for electricity, they use it to make fertilizer, they use it for manufacturing, electronic glass manufacturing, and of course, you know, it's used also for atomic bombs, it's also used for fuel cell, for hydrogen cars. So there are so many applications already. But today, I want to talk about medical applications, of course. And I summarize here some of the hundreds of studies are all within this realm of biomechanism. Many people study molecular hydrogen as an antioxidant, as an anti-inflammatory thing, as for cytoprotection. Also, you see, our body works on cell signaling. So if your signal is wrong, for example, you can get cancer and things like that, or you can have some genetic problem. So signal modulation is important. It has mitochondria, but mitochondria is the battery or the energy cell inside each cell. Each cell has energy because of its mitochondria. So this hydrogen can detox and protect your mitochondria. It is also proven for hormone regulation, for gene expression. Basically, again, when your body is out of balance, sometimes the gene expression is all wrong. Certain genes that you want to protect yourself from cancer doesn't happen. Other genes come up. So then you have genetic problem. So hydrogen has been shown to regulate that. And of course, lastly, and most importantly for hydrogen is it can regulate our immune system. The names I put there, Dolkaya, Garib, Aitopin, these are all scientists and doctors. Et al, for those of you who don't know, et al means he's the lead person, but there's a team. Usually there's 3, 4, 5, sometimes even 10 scientists that are doing the research together, okay? So when we see et al means all the people together with him, but this is the main scientist. For those of you who love to read, maybe now MCO, you're at home, nothing to do, you can Google this name, you can read the study, but you have to love the science. So these are all the areas of biomechanism study related to hydrogen. So more importantly for us is, how about diseases, right? We look at diseases, right? We are in the medical line. So again, the list is very long. Why? Because if you go back to this, we're talking about antioxidant, anti-inflammation, signal modulation. All this relates to the function of our body, relates to the function of our cell. So therefore, it relates to almost every disease in your body, correct? When you talk about immune regulation, you just cannot pick one thing. The whole body is related, from your blood to your digestive system, is related to the immune system. So when it comes back to the diseases, there's a lot of people who study it. And you can see all the scientists' name there. You can Google them, depending on what are the areas you write, you know. Nephritis is kidney, diabetes, you know, Alzheimer's. We have different cerebral, which are brain-related diseases like Parkinson's. We have cardiovascular, stroke, heart diseases. We got malignant neoplasms, which is cancer. We have skin, neurodegeneration. We have, of course, infections. We have gastro problem, oral pathology, basically your gums and your teeth, obesity, anti-aging, which is very interesting, chronic respiratory, which is related to our respiratory system. And of course, because of that, there are studies already done for COVID-19 as well. So these are all the diseases. Of course, there are so many here that you're not going to remember all. So I put in a picture so that it's easier. This is from a book written by a scientist. So you can see this actually corresponds to my list. Okay, you've got metabolic syndrome, inflammation, neuro diseases, vascular diseases, aging, fatigue, radiation damage. So you can see that hydrogen has a big role. Molecular hydrogen has a big role in our body. Okay. For those of you who like to do more research, I know in this group now we have some doctors, dentists, scientists, pharmacists who are listening in. And because you like all this data, just like me, I spent many weeks to study this before I promoted the hydrogen. So you can see for yourself, these are all the useful links that I found, and you will go crazy with all the scientific studies. Even in Malaysia here, our Ministry of Health, we call it MOH, also has a write-up on molecular hydrogen, believe it or not, for the management of COVID-19. The interesting part is the government writes about it but they don't practice it. They just tell you that if you can buy the machine, if you have ability to source it, then it can be good for you, both the molecular water and the molecular gas. All right. So for those of you who are interested to read the full article, I will give you a link and then you can go have a look. Okay. In fact, the link is here. Yeah, sorry. The link is right at the bottom. You see COVID-19 MOH, GOV government.my, which is Malaysia. MOH is Ministry of Health. So there's 1, 2, 3, 4, 5 links here. Okay. Now, why does hydrogen work so well? Because our body is constantly in a state of being attacked by free radicals. Free radicals is the source of diseases, is the source of aging. The reason why we grow old, why we get wrinkles, why we fall sick is because of free radicals. And how do we create free radicals? From sunlight, UV light over excessive UV light, smoking, radiation, even air pollution, and the worst part is metabolism. That means when you eat, you are creating free radicals. The more you eat, the more free radicals you are creating. Even exercise. The more you exercise, you have to breathe heavily. The more oxygen you bring in, the more free radicals is formed. Okay. In fact, people with cancer has 50 times more free radicals than healthy people. If you have like diabetes, it is 30 times more free radicals than normal people. Every breath we take contributes about 3 free radicals. So we are constantly bombarded with these things that make us sick and make us age. So therefore, and you can see even this is the effect. The free radicals will create a lot of oxidative stress, and that is why things like apples and fruits will slowly decay. You can see your healthy skin on the left, and this is what happens to you when you are 60, 70, 80 years old. You dry out like that. And you can see on the left, there's the normal cell, and you have the free radicals attacking the cells, and then all these cells go under oxidative stress, and it becomes diseased. Okay. Now, so now we know that free radicals are the root cause of inflammation, root cause of aging, root cause of diseases. So how do we protect ourselves? Well, the body has some protection. We get protection from the food that we eat. If there's not enough, we can take supplements. So we need something called antioxidants. All of us heard of antioxidants. The problem with food antioxidants, the problem with supplement antioxidants is they need to be metabolized. What is metabolized? Need to be broken down by digestion. Your body needs to have enzymes to break it down so that it can be absorbed, so that the antioxidants can do the job. But some of us have poor metabolism already. And the more we metabolize, the more free radical is created. So it becomes double jeopardy, right? So if you take a lot of supplements, not all the supplements can be metabolized, depending on what kind of supplements, right? If these supplements are not broken down into proper antioxidant that the body can use, it will create toxicity and create stress for your liver that has to detox, and the kidneys have to excrete it, which is why for people who take a lot of supplements, a lot of medicine, they will eventually get kidney failures. So we have to be very careful with all these supplements, all right? So now come to our good friend, hydrogen. Actually, it is nature's super antioxidant. Number one, why? Because it is the smallest and the lightest molecule in the universe. It can directly diffuse into bloodstream, into your tissues, into your organs, into your cells. This is a wonderful thing. It doesn't have to go through digestion. Do you understand? You don't need to metabolize like what I said just now. And it can cross we call it permeate and diffuse through cell membranes. Again, it can reach inside your cell, which is where it is needed to clean up your mitochondria, to protect your mitochondria, which I told you earlier is the battery of our cell. And all the little organelles, the nucleus and things like that that are inside the cell. And most importantly, our brain is protected. It can cross the brain barrier, which is why molecular hydrogen is so good for many brain-related diseases. On top of all that, it is safe. It is non-toxic. You can take more of it, doesn't matter, okay? Because the byproduct will just be water. So therefore, when you consume hydrogen, whether as a gas or as a hydrogen-rich water, it acts like you are having intravenous. It acts as if you are doing IV. You know, when you go for drips, you will have an IV or injection straight into your blood. Here, the hydrogen crosses straight into your blood and does the job. You see? So every time you drink hydrogen water, every time you breathe hydrogen, you are getting an IV. Just to compare what I mean by size, you look at the size of the molecule hydrogen. It's the size of 2 because it's only got 1 proton and 1 electron. If you like to take vitamin C, look at the size of your vitamin C, 176. Many of you know that, oh, vitamin E is good for me. You go to the pharmacy, you buy a few vitamin E pills. The size is 431. Coenzyme Q10, many people take for heart condition, 863. Catechin is what you find in green tea, right? Many of us know that green tea is good for you. But look at the molecular size. Glutathione. Glutathione is also a very popular antioxidant, 300 over. So you look at it, there's no comparison. All these antioxidants, the big ones, need to be broken down. And that puts a strain on the body, okay? But in terms of molecular hydrogen, this is what happens. The red color is the free radicals that I mentioned that creates diseases and creates aging. You have the molecular hydrogen that neutralizes it. And what is the end effect? You get water. But if you take those other antioxidants, you're not going to get water. You're going to have other byproducts, which I told you earlier, your liver and your kidney has to do the job of getting rid of it. This is the brain barrier. On your right, you can see the bloodstream. The large molecules cannot cross into the brain, but you can see the small molecules already enter into the brain, which is why hydrogen is so effective, both in water and in gas form. All right. So how do you administer? How do you put in hydrogen into your body? There are 5 ways. You can drink hydrogen-rich water. You can inhale the hydrogen by breathing in. You can inject in hydrogen saline solutions. Okay. You can put hydrogen into eye drops and use it as an eye drop. Or you can take a hydrogen bath, the hydrogen water, and then take a bath. In Japan, they're crazy about hydrogen bath. You know, Japanese, they love to do all kinds of baths, but hydrogen bath now is very popular for health reasons. So when you use an oxyhydrogen purifier like this one for A, this is the period of time that you will use it for. For your eyes, will be hydrogen only for 30 minutes. For your ears, which also helps your brain, you can see the center picture. I'm putting it inside my ear. Again, pure hydrogen for 30 minutes. And if you inhale, it is better to have hydrogen in combination with oxygen, right? Why? The other two, on the eye and the ears, when you are taking in the hydrogen, you are still breathing in normal oxygen, so you're okay. On the other one, it is better to include the H2O2 combination because you want to breathe in both, okay? Now, this oxyhydrogen machine uses a lot of special technology. It's got an FDA registration number, as you can see. It uses separation membrane technology, which separates the hydrogen from any other gases. It splits the oxygen and the hydrogen into 99.9999 hydrogen, 99.9999 oxygen. So you don't get ozone or any toxic material. All right. The electrolysis plate also uses pure platinum. So this is very high quality, and the machine is intelligent. On the right, you can't see very clearly. It can sense if you overuse it without resting. It can also detect water shortages, and if you imbalance it or you tilt it, it can also give you a warning light. So it's got all the intelligent detection. All you have to do is use it properly, plug in, and you can use it. How do you use the oxyhydrogen? Well, you put in 1.5 liters of distilled or RO water in the machine. You plug it in for 1 hour before your first use only. And after that, you can continue using it for 30 minutes, 1 hour, 1.5 or 2 hours. Okay, the water will last about 40 hours. After that, you need to top up. After 4 hours of continuous use, let the machine recharge for about 30 minutes. All the warning lights are there. And the beautiful part is there's nothing to clean. There's no filter to change. It's zero maintenance. Okay. Now, how do I use this? How do I use this oxyhydrogen air purifier? Well, for preventive purposes, for your immune system, you want to inhale the combination. It is already preset. It is preset for 67% hydrogen and 33% oxygen. So for people who smoked, people with asthma history, lung condition, even heart, brain, liver, kidney, nervous system problems, you need to breathe for an hour, up to 2 hours a day as a preventive and also to maintain your health. If you are using the eyes, hydrogen only in the goggles, you would use it for 30 minutes. If you're using it for your ear, which also diffuses into your brain, you would use hydrogen only for 30 minutes. Now come to COVID-19. For COVID-19, you need to inhale the hydrogen and oxygen combination for 2 hours, 2-3 times a day. And it is best that you also drink the hydrogen water 3 liters a day. For cases where the earlier you start, the better. Don't wait until 2-3 days later when the virus has become very fully loaded. You want to start inhaling and start drinking the hydrogen. Okay, and later I'll show you why it works. This is the study that already has been done. China, being such a big country, has the whole COVID-19 situation under control. For those of you who want to know more, please buy this book or download the ebook. You will find very interesting data and how they attack the COVID-19 situation. The whole thing was led by Professor Dr. Zhong, who is a pulmonary, basically lung specialist. He is a SARS expert. He was the one who first handled the SARS problem about in 2003. So he knows the history, because you have to understand, COVID-19 is called SARS-CoV-2. It's another version of SARS. Of course, now you have different mutation coming up. So what they did was, in 32 medical centers, they treated 500 over patients. Of course, like in all study, some of the patients, they didn't give hydrogen because they want to see the effect. And 300 over, they give real hydrogen. Then they want to compare. You have something called the control group and the treatment group. So what did they find? They find that this is the result. Just from second, third day onwards, cough symptoms, shortness of breath, which is a big issue, dyspnea. You have chest pain, chest tightness, depression, you've got a lot of problems. Immediately, you can see how fast it dropped. Within 10 days, everything starts dropping. And this is only the result of breathing in hydrogen and oxygen combination, right? This is a real world evidence. This is not rats. This is not theory. This is real humans and real case, all right? There were many, many, many photos, but to cut this short, I pick one only. This is a woman, and you can see this is what happened. So those of you who have been following the COVID situation will know that there is scarring of the lungs. You get lesions like that, white, like glass like that, right? Many of us have seen these photos, say, wow, especially those who die, when they do the autopsy, they can see this thing. This is the lung lesions caused by severe inflammation in the lungs. Look at this. Believe it or not, from the left to the right, it's only 5 days. Not 5 weeks, 5 days. The lesions are almost gone. The inflammation has all been absorbed. And the lady is up and running. And she took a photo with her friends because she was so thankful. There is a video recording some of these oops.
We just finished some of the data from 3 hospitals. We use hydrogen and oxygen mix.
Yes, yes.
It seems to be working very well. I am happy about that. So I just got the data right now. So from Wuhan and from Guangzhou, and 3 hospitals, altogether 60 something. And after inhaling this hydrogen and oxygen mix gas, they improve. Dyspnea improve the 2nd day, and the 3rd day, and the 4th day. So all of them showing really improved. I suppose because of at least resist to reduce the airway resist the gas resist airway resistance. So much easier to go into the alveoli to improve the oxygenation. I think that's a good way.
你刚才吸了有什么感觉？就是吸了之后来了之后这么多天，这个胸前呢没有改善，就真的用了这之后啊，这个胸前都改善了，是吗？不痛了，不痛了，不痛了，一点都不痛了。那太好了，谢谢你啊，万秋啊，教授啊，这里今天这第1回好爽啊，这个味。
阿姨，你用了那个氢氧机，感觉怎么样啊？
感觉很舒服。
很舒服，是不是？
没有什么不好的感觉。
有没有说觉得胸口就是吸了之后感觉很顺畅啊，或者是吸气的时候觉得就是很顺一点感觉？
对。原来一深呼吸呢，就会咳嗽。但是用了这个以后呢，咳嗽啊，基本上没有了。就是深呼吸的时候都不会咳嗽。
好。你用这个机感觉怎么样？
用这个机感觉还可以。
有没有说觉得好像吸气会更舒服啊，更顺畅，就是更顺畅一点，是不是？
对。特别是第1次用的时候。
什么感觉？
感觉就是像气道打开了一样。
这种感觉。
对，以前不敢做这个深呼吸。用了它以后可以深呼吸。
好的。
你感觉吸了这个机之后感觉怎么样啊？
吸了半天就感觉胸口就不痛了。
不痛了。
就没有那么痛，然后现在都不痛了。
现在不痛了。那就以前生活的比较痛。
之前是胸闷，前面这里跟后背都有点痛，然后吸了这个吸气以后就半天以后就感觉就舒服很多，就没有痛。
好，谢谢啊。
This is the lady. Because COVID is a respiratory disease, it starts from your nasal throat area and then it comes down to the lungs, right? And then that's where all the damage is done. Now, we talk about FDA registration. Why is that important? For the water device, we have an FDA number. For the oxyhydrogen purifier, we have another FDA number. It's all registered with the US FDA. Why is it important? Many people ask me, so what? It is very important because without it means you could be using inferior, poor components, poor manufacturing. And you know why? These things can degrade. They can tell you that it's rust-proof and all that, but you don't know. And once it degrades, it can leach harmful, toxic substances, which can cause you different kind of diseases. You don't want to have ozone or different oxides. because you are drinking and breathing it in all the time. You cannot compromise your health. So you must insist that FDA means safe. We're not talking about a drug. We're not talking about medicine that needs like a vaccine that takes a long time to do. This is a consumable product, but at the same time, you want it to be safe because you are drinking every day and you're breathing in all the time. Okay, so insist on FDA certification. So what can the water do? I already showed you the oxyhydrogen can do a lot of things. For the water, because we have been using it for a year or two, couple of years, so we have seen tremendous improvement in sugar control, blood pressure, cholesterol, uric acid, prostate, and all kinds of inflammation. And wonderful for your stamina. And as I said, it is also very good for anti-aging if you drink it as well as bathe in it, soak in it, spray in it. It is very useful for your skin. Now, in terms of COVID-19, the water also plays a very important role because the infection starts in the nasopharynx area. So the hydrogen, as I mentioned earlier, acts as a wonderful antioxidant, anti-inflammatory. So it will block your throat from getting worse. But assuming that it's a bit too late and you didn't start drinking, it has a second role, which is more important because that one is the one that kills you. Your immune response. If your body over-respond, non-stop, keep shooting the bullet, eventually the bullet also will kill all your organs. And that is why you have death through organ failure, created by something called a cytokine storm. You will read this word in all these COVID people who die. It is basically an uncontrolled inflammation, your body attacking itself. So you need the hydrogen, both in terms of gas and water, to regulate your immune system so it doesn't go crazy. Okay? So the magical question that everybody asks me is, hey, given a choice, which one should I do? Should I drink the water or should I inhale? Well, ideally both, which is what I do. Okay? And why? Because the inhaler is best for respiratory, lungs, heart, cerebral, which is your brain, oral, your gums and your teeth, your eyes, your ears. And if you are a smoker and if you have pollution where you stay, then this is ideal for you. But the hydrogen water is also very good because you always need cell hydration. You need cell detox. So it's very good to keep yourself hydrated, to improve your blood circulation. It's also good for your gastro. As I mentioned earlier, our body produces hydrogen by itself in our gastro. So hydrogen is always very helpful, good for the skin. We have a lot of testimonial of people suffering from gastric and things like that, and they're getting better. Super for athletes, because athletes work out a lot, produce a lot of inflammation, produce a lot of oxidative stress and free radicals. You need to keep drinking the H2 water. Now, don't forget, as I mentioned earlier, the H2 water can also be used to make eye drops and also to make a water bath, okay? Price, that's the next question everybody asks me. How much will it cost? Okay, it's a standard price worldwide. If you're in Europe or somewhere else, you just have to convert it. The big machine for the water is 8,990 in ringgit, okay? So now it's very cheap for the Europeans because ringgit is quite weak, right? And then it's about 1,008 something in euro, okay? Or you can get 3 portable units for the same price, ringgit 8,990. For the oxyhydrogen purifier, it is 9,990 for a single machine. The next question everybody asks me, Dr. Jerry, can I get a discount? I say, sure, everybody likes a discount. What you do is you can get very good, attractive referral income, right? After you use it, you find that it's very good. I'm sure your friends, relatives, whoever, your colleagues would like to try one. So from being able to get some rebate and some referral income. All right, I won't go into detail today because there's a whole section. So please discuss with whoever invited you for this session, and they can explain to you how you can get some referral income. And I can tell you, it is quite attractive. In terms of testimonial, I have many, so I don't have time to show everyone, but let's pick a few ones. This one is interesting because this uncle has been taking sugar pill for, I don't know, 10 years, but his sugar is still high, above 10 all the time, even with the medicine. So obviously he has to go for insulin injection to 6 point something within an hour. So he was very happy. He immediately took the unit and he started drinking to control his sugar. This is a younger gentleman who doesn't believe that he's got high sugar, but he has. It's almost 11 and this is just a normal work day. And he drank the water and it dropped to 7. So 90% of people, I won't say 100, 90% of people who have high sugar will see a drop. For those who do not see a drop, you got to continue to drink. Why? Because your body is in homeostasis. That means it's maintaining a certain sugar level to make you comfortable. You know, our body is like that. When you're so used to a sugar level of 10, if it suddenly drops to 5, which is good, you feel dizzy, you feel cold, you feel tired, because your body for years has been at 10. You know, this is called homeostasis. That is, it is equilibrium for you, and suddenly it drops, you feel uncomfortable, right? The sugar will take a while to drop for certain people because there's a lot of stored sugar in the liver, which we call glycogen. It takes a while for the liver to clean out. So be patient, okay? And this is inflammation. This is a typical case of an inflammation where the lady got a fall, tripped herself and banged her lips, and of course immediately it swells up. Usually they will have to take some steroids and things like that. But since I was at the same dinner, I just loaned her the water to drink for 2 hours and I kept spraying. I put it in a spray and I kept spraying, and then after 2 hours, she was back to normal. So imagine, this is external, you can see it, but imagine if your liver is inflamed, which you don't know, you may not feel the pain, which is why a lot of people get liver cancer. Suddenly, they do their medical checkup, everything is fine. 1 month later, the doctor say you've got stage 4 liver cancer. How could that be possible? Because the liver has no pain. It could be swollen, it could be hardening, it could be having a tumor. You don't even know, because depending on where the tumor is, there's no pain cells, there's no nerve ending, so you don't feel it. But suddenly it hits you. So therefore, there are people who drink the water, who breathe this device, and they say, I don't feel anything. Some percent of people say they don't feel anything. But they have to understand, not every part of your body has pain cells that you can feel. But all you have to know that it is giving you healing therapy. Okay? There are many people who drink the water or breathe the air, the hydrogen, oxygen air. They will feel lightheaded, they will feel tired, sleepy, headache, many kinds of feelings. But it goes away after a few days. As I said, your body is readjusting to a new paradigm, which is getting you out from a certain homeostasis situation. This is a very severe inflammation caused by psoriasis, and all kinds of skin doctors tried many things, doesn't work. And here, just by drinking and spraying, but not overnight, of course, several weeks, he was able to improve almost back to normal. Okay, this is another situation where you have an inflamed venous condition, very ugly, very bad. So you can see the improvement. This is a new case because the oxyhydrogen is a new device. We've had it for only about 2 months. This gentleman underwent nasopharyngeal cancer treatment of the throat, and by using oxyhydrogen and hydrogen water, he totally suffered 0 side effect from his treatment. All the other patients around him were having vomiting and having bleeding in the gums and a lot of sore throat, all kinds of problems. But he was surprised. He said he felt like just normal. Okay, today his energy is high and his cancer is under control. And this is an interesting case because none of us look for him, he looked for us. When he came back from China, where he was using an oxyhydrogen and hydrogen water machine, he was unable to locate one that is good, that is FDA rated. So he looked around, searched around, and he found the office, and he came in and he bought it for himself. So this is a really interesting story. Now, coming back to COVID. If you get COVID, this is the amount that it's going to cost you. Okay, if you have simple, very mild, no symptoms, you're talking about a few $1,000s, right? If you go into ICU, we are talking about 20 to 70,000. And of course, if you start having organ failure and the hospital is trying to save you, you're talking about 100,000 plus. So please stay safe, don't get COVID. And if you compare now with the 8,000 something for the water and the 9,000 something for the machine, to me, it's a no-brainer. It is cheap. Because, why? You can share with the family. You just buy a separate tubing, which is only 20 ringgit. You can share with the whole family and you can use it all the time, not only during COVID time. Okay, it will stay with you as long as you want to remain healthy. Okay, so what is the message to take home? We call it a take-home message. The conclusion of my whole 30-40 minutes talk is only 3 things you need to remember. The root cause of all diseases is free radical damage, which creates inflammation and oxidative stress, which creates diseases. Okay, you have to understand that. Instead of taking all kinds of antioxidant or relying on all kinds of things, Mother Nature already gave you molecular hydrogen. It is a super antioxidant, because it is so small. It can go into your blood vessel, it can enter your brain, it can enter your cells. No other antioxidant can do that. I already said it is like doing a drip straight into your blood. It can go in, and that is the beauty of molecular hydrogen. Okay, and there are 1,000 over studies. Okay. Lastly, I'm not talking theory. I'm talking about evidence-based biomedical therapeutic benefits. I shared with you earlier the list of scientists and doctors who have done their research, not me, but they've done their research, and both molecular hydrogen gas and water provide such healing benefit. Okay,